Hi, Charlene. Thanks so much for joining us on Britain's Birth Stories podcast.
Hi.
Hi. So would you like to tell us where you're based and who's in your family?
Yeah, so I'm based in southwest London, and my family consists of myself, my daughter, and my son, and then sort of co-parent with the fathers.
Wow, amazing. And do you have a profession apart from taking care of your family?
Yeah, so I recently qualified as a mental health nurse. So I work, usually, I'm on maternity leave, but I usually work on a female acute ward in the local trust, which is basically a sort of 24 beds, female-only ward in southwest London as well, on one of the hospitals that deal with quite like crisis mental health.
Yeah, wow, that's great. Okay, amazing. Right, well, let's get into it.
Okay.
So your first pregnancy, was that something that you'd planned, or was that something that had just happened?
In my first one, even though it was a shock, I could say, I guess I did want to have a baby at that point as well. I'd had a loss previously, so then I think I felt even more like wanting of this baby, of the first one.
Yeah.
So it's kind of like I just semi-planned.
All right. And how was your pregnancy overall for you?
With the first one, in 2008, that was, the pregnancy was all right, actually. It was okay. I didn't have the morning sickness and the things that, like, a lot of people talk about in terms of, like, the morning sickness and the nausea and all that. But to be fair, I think that my age was probably a big part of that. Not that younger people have it better, but I just think I'd just finished uni. I was just sort of still bopping about. Like, I was just, I just feel like I was more active maybe anyway. So maybe I didn't pay attention to any symptoms that I was having. I sort of passed it off.
Yeah, okay. Right. And had you thought much about birth and labour and things like that at that point?
No, not really. The first one, I was kind of, I guess, didn't know what was to come. You hear all the sort of positive stories, but you hear the negative ones too. So it was a bit like, sort of just thought I'd go with the flow. I think I was actually probably less worried about the birth and things with the first baby, just because it was like the unknown. So it's kind of like almost like, oh well, how bad can it be, sort of thing.
Yeah.
Which, so I just thought, it'd be fine, sort of thing.
Right.
But that changed.
And did you know maybe where and how you'd like to birth at that point?
I definitely thought about water birth. I was actually heart set on having a water birth with my first, and I just thought that all of the things I'd heard, like all the positive things about it being calming and helping along the birth, I thought, brilliant, because I kind of was beginning my journey as sort of like I don't know, like it felt a bit like a hippie mum thing to do, to have a water birth or whatever. And I thought, that seems to me a bit more free flowing, a little bit less medical intervention sort of thing. And I thought that would be something that I'd be really interested in doing. It didn't end up that way, but that's what I'd planned.
Yeah. Right, that's great. And let's go straight in. How did labour begin, and how did we go through that?
With my first one, the labour was, I remember I think I had a show a few days prior, and at the time the social circumstance I was under was just very messy, so it was like I wasn't living in the vicinity that I'd initially registered the pregnancy in, if that makes sense. So I was travelling from south back to North London to go to the doctors, and I remember thinking that I had a show and I was like, oh gosh, any minute now, better get home back and get to South London. came back to Southampton.
Yeah.
And I was like, right, if this is going to be labour, I probably should get some food. So I went to a supermarket and I was just walking around. I was having contractions and I spoke to my friend and she was like, yeah, it sounds like you need to go. No, like, it's just a little bit of pain, it's fine. Like, I need to get some food, that's more important. So I'm walking around, and by the time I'd finished doing my shopping, I was like, yeah, I feel a bit like maybe I should go in now.
Yeah.
So I got the cab home. We had a couple of false starts where I thought, like, yeah, but the contractions didn't increase. So I ended up being sent home from the hospital. And then I think eventually I was dilated enough. I think I was at maybe 6 centimetres with her. And then they're like, yeah, you're in established labour sort of thing. So I ended up going through that. But that lasted for actually about 3 days.
Oh my
I think I went in on the Monday. She didn't actually end up coming until this Wednesday afternoon.
Wow.
And it was just, I think by the point that my daughter ended up coming, they were getting me ready to go into like an emergency cesarean. So I'd had everything. We were just waiting on the anaesthetist. And so they're like, oh, we're just waiting on the anaesthetist, you know, it'll be fine. Like, and I just felt the urge to push.
Yeah.
So they got me a squatting, what do they call it? Like a stool that you can sort of squat over.
Yeah.
So a birthing stool, I think it is. And so they were like, yeah, try this, like sit on this. And I gave about 3 pushes and she came out.
Oh, wow.
So I was like, oh, no need for the anaesthetist, like, we're fine. It's very shocking and I just felt shock, I think, was my initial fear.
Yeah.
It's just like, oh my gosh, that's just come out of me. Oh my gosh, it's alive. Like, I just was completely overwhelmed by it all, to be fair. I think, obviously, the days of all that time that I was in labour as well, sort of, obviously I had like a lot of medical intervention. I'd been given they hadn't given me an epidural, but I did have pethidine and gas and air.
Yeah.
So I think by that point I was kind of a bit out of it anyway, just a bit like, wow, 3 days of gas and air and pethidine, I think I'm done. So yeah, by the time she came out, it was a bit shocking.
Oh, wow. And then what were the first few hours like with her?
Around that time, it's brilliant, actually. It was, because it was just so different to my second birth. Even though the labour itself was really traumatic, afterwards, obviously, you're still allowed, like, visitors. My family were there. There was my partner's family at the time were outside as well, sort of, waiting to come in and that. So I was able to see people. I stayed in hospital overnight. They were thinking that they'd have to give me, I'd lost quite a lot of blood. Right. So they were thinking that they would have to give me a blood transfusion at some point. So they kept me in. But at least like the next day, my partner was able to come in. I was able to have a shower. That night, I remember thinking like, oh my gosh, like she's actually here. I remember she got hiccups and I didn't know about babies having hiccups. So I was like, oh my God, something wrong with her? She keeps doing this weird sound. Ran to the nurse's station and they were like, no, it's just hiccups. I was like, oh God, really? Like, oh, the baby's had hiccups. Like, so I was just like, the few hours after was nice where I got to hold her and sort of have that skin-to-skin contact pretty much straight away.
Wow, yeah.
And it was quite nice.
That's great. And what were your thoughts on feeding at that point? What did you choose to do?
I started with breast milk at that time straight away, but it wasn't, I feel like it wasn't like overly encouraged.
Right.
So I just felt like there wasn't any support for me to continue with that in a sense. So then when it got to the time of sort of, getting home and getting actually into routine or getting back into daily life, it almost, I guess at the time, it almost felt like the breastfeeding option was inconvenient, which I find weird now because with my newborn, I am exclusively breastfeeding. He's 6 months.
Right.
So there's that sort of, I guess, in hindsight, that reflection looking back, I'm like, oh gosh, it really wasn't encouraged or spoke about or sort of it just seemed like it's inconvenient. But now I feel like it's the most convenient thing in the world. So everything's completely changed in that perspective. But yeah, I decided to breastfeed, tried to do it for as long as I could, but she ended up getting teeth at 4 months, and then I was like, oh, well, I just can't do it then, I suppose, like, you know, she's got teeth, what am I going to do, sort of thing, and I didn't really have anyone else to turn to sort of saying, oh, it's okay, you can get through that. So we ended up doing breast and bottle for a little while, and then, yeah, eventually, by the time she got to like 5-6 months, she was pretty much on bottle. But I think there's a lot of pressure from other people to, it's like, sorry, even like healthcare professionals will be like, oh, you know, do you want to put onto bottles so you can share the feeding, or do? And I'm just like, well, no. You know, at that time I was a bit more, I guess, like going along with what other people were saying was the good thing to do. But now with my newborn, I'm like, no, I'm fine. I quite enjoy the breastfeeding. I'll stick with it.
Yeah, that's great. And looking back at it now, how do you feel about the support you received during labour?
With my first one, yeah, there was a lot of people around professionally, from the medical professionals. There was a lot of support. I can't really say the same with my newborn, but yeah, with my first child, there was a lot, I did feel like, yeah, I was well supported in terms of them being there, like physical presence, and there was always a nurse with me. You know, they were very good at communication. Great.
Well, no, it's glad to hear that, although it may not have been the birth that you had planned or expected, that the support you received was fairly consistent.
Yeah, it meant a lot. It sort of definitely, I think maybe I took it for granted at that time. Because the second time around was completely different. So, yeah, I think that it was good at the time.
And how did you cope personally during the postnatal time?
I found it kind of hard. I wasn't living at home, so, and I sort of was kind of homeless at that time, I guess. And so I found it hard to do the things that are like recommended and spoken about, you know, getting people in to help, sleeping when the baby's sleeping, let your family cook, and all these sort of things. I didn't have that set up. So it's kind of like, you know, it was a bit of the adjustment periods was more of a struggle because of it. Nothing that I was sort of seeing out there was representing my situation or relevant to my experience at that time.
Right.
So it's kind of like, you know, I have this newborn baby. I'm loving the idea of being a mum. I can't wait to sort of I remember thinking, oh, I can't wait till she gets bigger so I can give her a proper hug. Like, I just wanted to squeeze her. She's gorgeous. And then, you know, that, and with the back set of like, but practically I have to sort out my house I have to go and do this, I have to do that. Like, I can't, it felt like there was no time to just enjoy it. So to speak.
Yeah, that's unfortunate.
Yeah, it's just a tricky time, but you know, I just think it's amazing what you're able to sort of get through when you're faced with it.
Yeah, definitely.
So I just had to keep going.
Great. And you've kept going all this time, and then now you've welcomed another baby. So how did that come about? Was your second child planned as well?
Gosh, that was, again, I would say semi-planned.
Right.
I said at the beginning of last year that I wanted a baby by the end of the year because I'd always wanted another child, but it just, I guess, never happened in a sense. I filled my time with other things as well as my daughter was growing up, and obviously she started school and all that sort of thing. So, but by the end of last year, she was finishing year 6, and I was thinking, oh my gosh, maybe it just won't happen. I've got in my head that, like, I'm just not going to end up having another kid. It's fine. I'm just going to have one kid. That's fine.
Yeah.
And so that happened. So then, Yeah, I ended up falling pregnant with my current partner, so to speak, and basically it was a bit of a surprise, but I think it was more of a surprise that it even happened.
Right. Yeah.
Rather than the actual pregnancy. It was just like, like I think I'd convinced myself somewhere that I couldn't have babies or something, but I definitely drummed in something there. So that was, again, the pregnancy was kind of all right. I was working through it, which was the first time that I'd done that.
Yeah.
Obviously, when I first had my daughter, I was just at uni, so it's just, but this time I had work to consider and the sort of telling them and and just being like, oh gosh, like I felt bad. I felt really guilty that I sort of like not long started and I was pregnant. I was like, oh, I felt really bad, but I had to think that my want for that baby trumped my feelings about work, sort of thing.
Yeah, definitely. And then what were your thoughts regarding this birth?
This one, I was so like, I felt so much more adamant, I guess, about my decisions and my choices. I had a really good midwife, and that was one thing I didn't have with my first child, was the sort of consistency with the midwife care prior to the birth. I'd had like different, just see whoever was in that day sort of thing. And with this one, I was able to have the same midwife throughout my pregnancy, so there was already that sort of, that in itself is empowering, because you really feel like, okay, this person is getting to know me, she's getting to know my preferences, my choices, and she's supporting that. She's very supportive, and I wanted my daughter to be at the birth because I just think it's a beautiful thing anyway, but also, that's my little girl, so if she can see how things really are, then, might help with her understanding those things as well. So I wanted her at the birth, I wanted to have a water birth. Again, I sort of, over the years, had sort of developed anxieties, so I was definitely thinking, right, I need to have a water birth this time, because if I don't, I'm going to end up panicking, it's going to be really traumatic, and I thought that would help sort of do things like that. I feel like more natural if I was having like a water birth.
I
was kind of along the way being advised sort of against it by the doctors and stuff because of my experience with my daughter, but I was sort of, well, it was 10 years ago, so, don't give me a chance, guys. Like, you can't just write me off.
Well, exactly.
And they were like, oh, but you're this and the other, and I was like, no, I know what I want.
Good.
They unfortunately cancelled the antenatal classes and things. It was a bit like, they'd done that in April, and I think he was due at the end of April. So I was looking forward to getting stuck in with all the antenatal classes, really getting to know my body, really going for it this time, sort of thing. That sort of got cut.
Oh no.
Yeah.
So how did labour continue and progress and start for you?
With my son, he I think around the due date, I'd had an appointment. I think on his due date, I had an appointment with the midwife, and she was like, do you want to do a sweep? And I'd heard so much, like, I was in forums and on Google and all those sort of things before I'd had it, whilst I was pregnant. So I was like, yeah, I've heard about this sweep. I'm not actually keen on it. I'm all right, thanks. Like, I'll leave it. She was like, you sure? And I was like, no, you've got other appointments. It's fine. So she was like, well, if he doesn't come by Monday, then you'll come back in for an appointment and we'll do the sweep then. So I was like, okay, cool, that's fine. And I think it was Thursday night I started to feel contractions, and I was like, oh, okay. So I said to my daughter, I was like, right, let's go to sleep and get an early night, because I think this baby's going to come soon. And if he starts coming tomorrow, like, we need to be well rested. So let's, like, so we done that. The next morning I woke up and was still having the contractions. And at that point I'd been reading a lot about hypnobirthing, and I'd had the app and all these sort of things. So I was just like, right, brilliant. I felt really sort of encouraged to listen to my body. And I decided that because of the experience with my daughter of having the long labour, I thought, right, because I know maybe that's what my body's like, then I'm just going to wait as long as I can, wait it out at home, so I didn't have to be in the hospital for too long. But I'd actually started bleeding on the Friday morning as well, and I thought, oh, this is the show, this is happening, contractions, a show, right? So I'm ticking off the boxes, and then it continued, but I sort of was like, let me just sort out home, tidy up a bit. I was decorating as well because I've got that nesting bug really bad. And I was like, yeah, I'll just call the hospital in a bit. My daughter was like more sort of with it than me. She was just like, you need to call them, you need to say this. I'm like, no, it's fine, like, I'll call them later. So it got to like 5 p.m. I ended up calling them, and I just said, I'm not too concerned about contractions because I can deal with it. The pain wasn't, it wasn't unbearable, sort of thing. So I was like, yeah, I'm fine, but it's just this bleeding I'm worried about. And they said, come in, we'll check you anyway. My daughter was like, oh, do you think they're going to keep you in? I said, nah, they'll probably send me home. They just want to make sure the baby's all right. Got in there, obviously with all the restrictions and things, my daughter had to wait outside with her grandmother. And they monitored me, and then, in that time there was a shift change, and then another nurse came, and she was like, oh, okay, looking at the thing, but no one really says anything, and they just sort of look at the paper and all, like. So they were like, can you feel those contractions? I was like, yeah, right. I can tell that there's contractions. They were like, you're actually in established labour and you're 4 centimetres dilated.
Wow.
And I was like, what? Because I was still fine. Like, I felt all right with myself, I'd even been video calling my daughter in the waiting room, just being like, yeah, just waiting for them to see what they do. Like, I was laughing, joking. Don't get me wrong, when the contractions did come, I was sort of just breathing through them. But it wasn't, I was like, oh, okay. So they were like, yeah, you don't really seem that you're in labour. I was like, I don't really feel like I am, to be fair. But okay, if you say so. So they're like, yeah, we'll keep you in. This baby's coming, sort of thing. I was like, oh, brilliant. So they ended up taking me in. The nurse said to me, like, when you go upstairs to the wards, maybe try and, like, show them that you're in labour a bit, because they're not going to believe you. And I was like, okay, no problem. Like, so that was the beginning of basically, that was on Friday, and that was basically the beginning of another 3 days of labour.
Oh, wow.
So it was just ridiculous because, at the end of the day, they've got all these things saying that, women are allowed partners during labour or established labour, and I was in established labour, but because of, the wards and all this sort of thing, they couldn't have my partner just there. Yeah. And when I think about it, they wouldn't have let him stay for the 3 days anyway. So that's it. It doesn't sort of account for everyone. I think they should do it on a case by case basis, because really and truly, there is somebody that might go in 4 centimetres dilated in established labour and ready to push for the next few hours. Yeah. And then there's people like myself that I seem to just have prolonged labours. So that was the Friday. Because of my pethidine experience, I'd forgotten a lot of stuff with the first baby. I had to get told a lot of stuff by other people about what had happened. So I decided that I only wanted half pethidine dose this time. So I took the half, asked them for half, and they gave it to me. And I mean, to be fair, even up until a few months ago, I'm finding out things I was doing whilst I was on the pethidine. And my mum's like, you video called me. I was like, what? She's like, yeah, you was in the hospital room and you was video calling me. I was like, I don't remember that.
Oh, wow.
And then she's just like, yeah, my daughter was like, yeah, you was messaging me. I was like, really? It's like, I don't know what I thought was happening, but, yeah, so they took me to a room and left me with the pethidine, sorry. And I was using birthing ball at the time. I had all my stuff with me, but it was just me by myself in this room, just sort of trying to catch 40 winds of pethidine. And so that was going on all night. I was feeling sick and all those sort of things. In about 6 a.m, one of the nurses came and said, we've got somebody else that needs the room, so we're going to move you to the wards. So I was like, oh, okay, no problem. Got moved to the wards, and the contractions started a bit heavier. I was on the birthing ball. And I was like, oh, it's really happening, but still sort of doable. Like, I was just still breathing through. I had the gas in there by that point, which I was using. Then I went to the toilet, and I think my waters broke. So I was like, oh, gosh. And then, again, there was one other really nice nurse there that was very supportive and very much like, yeah, okay. Like, I didn't want to cause a fuss, but so I was just like, yeah, no, I'm fine. But she was like, check in on me. And then she said that the waters were a bit tinged, so she thought maybe the baby had, there was meconium, meconium in the waters.
Right.
So I was like, okay. So she's like, so I'm going to get you moved down to the delivery suite because you need to keep an eye on you now. And so I was like, okay, so that was Saturday. The pain did then start getting worse, but I wasn't dilating anymore.
Right.
So it just stopped. So obviously lots of like interventions of people coming in and checking and poking and prodding. Had to have, in the end I was just like, you know, give me an epidural please. Like the pain was getting a bit more intense, but I wasn't dilating still. So I had the epidural, that went on for a few hours, but then it stopped working. So then they were like, okay, right, we'll top you up with something else and we'll give it more regular. And I was just getting quite distressed. They gave me something a bit stronger, which I actually don't know what they gave me. But I ended up, that knocked me out completely. And I just remember I woke up at like 3 or 4 in the morning, because I think just before then they said to me, do you want us to call someone now? And that was about 9 o'clock on Saturday night. And I said to them, you know what, like, I'm really tired. So maybe that I'll rest and then maybe when I wake up. So they're like, yeah, no problem. And then about 3 o'clock in the morning, I woke up in like absolutely agonising pain, and there was no one else in the room. And I just remember, you know, you just feel sort of disorientated already. And I sort of screamed. I just remember screaming because you can hear loads of other people giving birth in other rooms around. And I just thought, oh my God, no one's in here. I'm in so much pain. I couldn't reach the nurse's bell. And the gas in there was next to me, but it was just like too far away. And I was on this sort of like, not even a proper hospital bed, it looked like a dentist chair. Like it was just, so I was just like, oh my God. So I just like screaming really loudly. I nearly fell on the floor because I was trying to reach for the gas in there. And I just started screaming for help because I was like genuinely like scared.
Yeah.
And a nurse came in and was like, oh, what's wrong? Like, you need to lie on your back. And I was like, no, I actually can't. The pain is in my back. And they couldn't work out what's wrong. But I was just in so much pain by that point. And then where I guess have my like little bit of nurses training, I guess I was looking at the machine that was like doing the observations.
Yeah.
And I was like, see, the baby's heart rate was just ridiculously high. So I was just like, no, you need to get this baby out. You really need to get him out. Like, he's distressed. But I think it was quite dismissed how I was feeling because of the fact that, you know, by that point, there was about 4 or 5 medical professionals. I was telling them, can you get the doctor? I need a decision to be made. I need cesarean.
Yeah.
They're like, oh, you don't need that. We'll just give you more drugs. Like, you just top you up on this or that. And I was like, no, I really need a doctor. So they're like, well, the anaesthetist is here. I was like, no, I need a doctor now. Like, and it was very frustrating.
Yeah.
Because I just felt like in this time where there's no one else to speak up for me, and I'm saying like, I really, like, you know, I know myself and I know what I need right now. And it was just sort of dismissed.
Mm-hmm.
I remember I kept saying the baby's distressed to the point the anaesthetist then said to the nurse, like, is the baby actually distressed? Like, can you just check? And then she was like, oh no, it's fine. And I was like, oh, like, oh my gosh. Like, so I think at that point, I literally just had enough. And they kept saying, like, lie down on your back and things that I personally now don't really believe in.
Yeah.
I think that, you know, the natural way to give birth is probably in a way that helps gravity and not against it.
Yeah.
You wouldn't go to the toilet lying down. So it doesn't make sense, you know, you're using the same sort of muscles.
Exactly.
So I didn't understand. I was like, no. They're like, yep, you need to lie down. That's the only way. And I was thinking, that's the most painful thing for me to see. So I was on all fours on top of this bed. They were like, you're going to fall? And I was like, no, I won't. I just need to be in this position. It was the only bit that was helping.
Mm-hmm.
I think I'd had enough by that point. I just turned around to them. I was like, everyone stop. They must have thought I was like ludicrous. But I was like, everyone just stop what you're doing. Just stop. Because it just seemed like they're just buzzing about. It's like a scene at a casualty. Everyone was just doing something, but no one was talking to me.
Yeah.
And bless them, they did stop, and they was just like, okay. And I was like, I really need you to do a cesarean because this baby needs to come out. I'm in a lot of pain. I've been pushing for 3 days. I've I've been here, you know, by that point, nothing was staying down either. I was very sick.
Yeah.
I couldn't even keep down water. So I was like, whatever we're doing isn't working. I need you to think of the next step. And they were like, well, you could do cesarean, but that's like worst case scenario. And I was thinking, I think I said to them, what is the worst case scenario? Because I've been in labour for 3 days. How much worse is it meant to get before you do something? So they're like, okay. And then literally at that point, they were like, right, we'll do it. And they decided to do the emergency cesarean.
Yeah.
That was about 6 in the morning. And I was like, okay, what time's it going to happen? They're like, now. I was like, oh, gosh. So I was like, brilliant. I just, at that point, really wanted to get him out. When we got to the theatre, they actually said that the doctor in the theatre was like, yeah, the baby is really stressed, we need to hurry and get him out. So I was like, oh, like, I was right. So can you just, you know, you can't dismiss everything that parents say or the mothers say.
Yeah, exactly.
And then, yeah, I mean, it's just hard being alone. That was the main thing. But I had really good 1 or 2 people along the way. So the anaesthetist at that point said to me, basically, I'd started having some sort of reactions to the drugs. So like my legs were shaking. I couldn't feel certain body parts. It was very weird. And the anaesthetist said, I don't know whether to give you something to numb you from the waist down or to give you something that will numb you from your neck down. And I thought of numbing as like when you go to the dentist and it just feel like a numbing pain or a numbing sort of sensation.
Yeah.
And then she was like, so they gave me the one from the waist down. I said, you do whatever you want, like, but she was trying to be, you know, collaborative, which was brilliant. I said, I trust you, like, you do what you want. So she done the one from the waist down. When they started, she says, can you feel that? And I said, yeah, it felt like a needle scratching me. Mm-hmm. She was like, stop, I'm not going to, like, wait, we have to give her the other one to make it numb from the neck down. So I was like, oh, okay. So they gave me that, because she was like, because I said, oh, it's fine, go ahead, just get the baby out. And she said, well, if you can feel that scratch, it will feel a lot worse. So I'd rather you be, like, you know, well prepared. So they gave me the other injection from the neck down, and I didn't realise, but I basically then started thinking I was dying.
Right.
And I got really panicked, started feeling like I was having a panic attack. But I couldn't feel anything, like I couldn't feel my heartbeat, I couldn't feel myself breathing, I couldn't feel any air. It was really weird.
Yeah.
I just felt like I was a moving head. And I couldn't even really speak properly. I was trying to say to her, like, I can't breathe. Like, I feel like I'm, you know, and then I felt like I went to feel sick, but I couldn't move my body even to convulse.
Yeah.
So it's kind of just a horrid experience in that sense. But the anaesthetist was really good. She was stroking my hair throughout. She stayed with me at my end of the table sort of thing and kept speaking to me.
Yeah.
They got the baby out. He was really distressed. They had to give him some rescue breaths because he weren't breathing when he first come out.
Mm-hmm.
And then obviously there's that sort of anticipation where I sort of was like, where he wasn't breathing, I just held my breath. I was like, well, I'm not going to breathe either. Like, I need to see what's happening.
Yeah.
And then he was born, thank goodness.
Yeah. Yeah. And how were the first few hours with him?
There was actually all right. It's interesting. After they sort of passed him to me, I was able to try and latch him on straight away, which I was wanted to do. So I was still sort of out of it with all the medications that I'd been on. I was completely numb, but I mean, it was, in an odd way, it was a nice bonding time.
Yeah.
I just held him the whole time until, I don't even remember when I put him down. I think it went until a few hours later, like in the evening.
Yeah.
I was like, okay, let me let him rest in his cot sort of thing. But yeah, the first few hours were all right with him, actually. He just got that skin to skin contact in, just tried to feed him. It's quite peaceful with him, actually.
Yeah, yeah. And how have you been postnatally? Because I know he's still young.
Yeah. I was really lucky. In the first week I went to stay with family this time round, and it was different to the first time where I had a home, you know, and was able to sort of come home after that time. So I think that's helped a lot in my adjustment to him being here.
Yeah.
Because because it's been in my own space and in my own time sort of thing. And I guess because of that, it's allowed me then to enjoy it a bit more, where I'm actually sort of like, I mean, the only thing that I really miss is the fact of, you know, by the time my daughter was this age, I was going to mother and baby groups and really meeting with other parents and having those sort of, you know, chats about just normal stuff, but it means a lot. But this time there's not that. So that's unfortunate. But yeah, I feel, postnatally, I feel like it's been a bit better. The shock is not so much, sort of. And I think, added advantage of like increased technology now than before. So it's like I can just Google stuff and it makes me feel a lot more comforted to know that other people are going through certain things, like the growth spurts and all of that.
Yeah, definitely. Wow, it seems like you've had two very almost similar but then completely different experiences.
Yeah, that's what I think threw me a little bit, to be fair.
Yeah.
Was the fact that, you know, like with the second one, I'm telling everyone this horror story of the first birth, and people are like, well, that won't happen again. What's the chances? Do you know what I mean? Like, it's fine. That's really exceptional. That doesn't happen all the time. And then basically went through such a similar experience again amidst the COVID pandemic. So it's just a bit like, okay, so I think, I mean, I guess maybe that's just how my body is. I guess, you know, some people have really rough journeys with the whole sort of pregnancy bit, and they might be all right for labour or vice versa. But I think that, I think my body just, when it comes to labour, it's a bit of an issue.
Right. So, obviously, we've covered your births and your pregnancies, but also I'd like to discuss maybe something that you're trying to work on, maybe from what I've seen online.
Oh, yeah.
Yeah, let's go into that a little bit.
Okay.
Yeah.
So, the Mothers Meeting.
Yeah.
So, basically, it's a combination of my passion and then also my newfound love for breastfeeding.
Yeah.
I have really just felt so much more empowered this time round with the breastfeeding journey, that I've sort of been so very sort of trying to normalise breastfeeding for others as well.
Yeah.
So I'm kind of like online shy of like, you know, posting stuff about me and my children. Quite private in that sense. However, in this time, I just recognise that actually, I don't know how to describe it. Like I was saying before, we had the groups and things you could go to. We had Sure Start and all those sort of things 10 years ago, and there's not really that around now. So I was thinking, how can I bring together something I really love? I love my profession. I really do enjoy mental health nursing. And when I first went into it, I wanted to work with children. But I've ended up working with women instead. And it sort of just opens my eyes to the sort of variety of lives that people are coming from. And I just thought it would be great if there was a space where you're recognised as a woman first and foremost, and not even just a woman, but as an individual with individual needs to be met, with individual problems that are not always related to being a mother, but just to being you. And I think that if you can empower the woman, then you can empower her as a mother.
Yeah.
You know, so it's like just giving people a platform. What I'd like to be able to do is to be able to connect just normal everyday people like myself with services that are out there, because at the moment obviously there's a lot of struggles. There's a lot of services that are picking up in the place of struggles, like doula support services and things, but it's bringing them to people. I had a conversation with a lady out in the shopping centre one time, and she was just saying she was, you know, had a 18-month-old and then she's pregnant again. And she's just like, you know, I'm going to have to give birth alone because I don't want to go to the hospital and I don't want my son to be left alone and all this sort of thing. And I was like, oh, have you thought about getting a doula? And she was like, what's that? And I just thought, people are really not aware of what's out there. And there's a lot of great people, especially that I've seen on Instagram and things. A lot of people doing a lot of great things for women, for mothers, even people such as yourself, like with the birthing stories and things. It's just brilliant, but it's just connecting the two.
Yeah, of
So I'm
course.
trying to create like an online presence where people can meet, where people can be referred to in terms of if they're seeking support, where can they be referred to? I was trying to make it area specific. So hopefully going forwards, I'd like it to sort of expand where it's sort of like people can look specifically in their area, what services are available for them, recognising that actually your experience makes you an expert on your own life, as well as like you might know things about cesareans or natural births that I might not have known, but you've known that through your experience rather than being dictated to by a professional, for example. And just also trying to complement the professional services that are out there, not to replace them, but just to sort of aid them in a sense.
Yeah.
I just think the empowerment side of things is so like, it's irreplaceable, because you can show someone how to do something and say like, do it like this and then you'll be fine. Or you can actually share your experience and then empower somebody else and go, oh my gosh, well if you can do it, I can definitely do it. I'm going to try and do this, and that will have a more lasting impact than anyone sort of telling someone else what to do. It's better that they sort of come together in a forum. And then the name Mothers Meeting was just like, I remember when, when you was younger and at school, you'd be talking to your friends and a teacher might come by and go, what's this, a Mothers Meeting? What's going on? Like, and so I was like, oh yeah, that seems like that's exactly what it is. A Mothers Meeting, a good old chin wag and that. I'm hoping to start some like online like virtual meetups and things like that, get some speakers in to come and talk about, maybe say for example like a midwife to come in and talk about how they deal with things from their perspective, because I think also there's some beauty and empowerment in, once you've shared your story, in having certain things validated and questions answered, rather than going forward thinking like, did I do this wrong, did I do that wrong? Maybe if you could ask a midwife, is that normal, is this, that and the other, then maybe it would help to eliminate some of those worries and pressures that we all have.
Definitely. Wow, that sounds amazing, and it's a great thing that you're doing for everyone.
Thank you.
No, thank you so much for being on today and for sharing your experience with everyone.
Thank you. Sorry if I've spoken a lot, but yeah, thank you so much for having me. It's been really weird to hear myself say it back out loud, but yeah, it's been nice.
Wonderful.